I have a lot of patients ask me, can I restore all my teeth with dental implants? And the answer is yes. And there's basically two ways to restore all your teeth with dental implants. One is removable, which is a little bit less expensive, but maybe um, might not be as strong or long lasting. And the other is with fixed, where they're not removable and they're more just like your natural teeth. Probably the most prevalent way of doing that is with a screw retained implant supported denture. And there are also cement retained implant supported prostheses. With that, the great thing about either one of those is a very common thing to do is get the bone ready first. Bone graft early and often, because that's always the limiting factor in restoring a case. And so a lot of times people will come in and they've maybe got their front teeth, and we want to be happiest in the shortest amount of time in a denture with the vision of having just your teeth in a day. So it can be done when the bone is grafted first. So we can do these beautiful sinus grafts in the back while you're keeping your front teeth. And these sinus grafts are the most prevalent type of bone graft that is actually needed. There are 80% of the cases need bone grafts, of 80% of implant cases, and 50% of those cases are sinus grafts. So generically, that's the number one most prevalent type of graft of all the spectrum of different types of dental implant bone grafts. So in a case with front teeth, we can place a bone graft in the back before the teeth come out, and before a denture is placed. We can get the implants in the back, and then before the teeth come out and before a denture is placed, we might be able to skip that step. And if we do this on both sides, put the bone in the back and the implants in on both sides, we can actually start to make a fixed denture, so that it's someone's not suffering with a denture. They can have a fixed denture with no palate, and it's virtually identical to what their final will be, with whatever changes they decide they want. If they want whiter teeth, they can get whiter teeth in the final. If they want a different mold, like rounder or longer, we can do all of that. But it's a good little test run to see, so that the day the teeth are removed, we fix into place in these back implants a fixed denture. And then we check it out, see how we like it, and whatever we want to change, we maybe put one or two or three more implants in the front, and then go to finish with whatever changes one would like to make. And it's a very versatile way of doing it, and spending as little time in a denture as possible, or maybe just skipping that step altogether and saving a little bit of money.